There's some pretty big news today with this whole healthcare thing.
It's every day. There's news every day on this whole healthcare thing. Now we get President Obama pushing back his trip because members of Congress thought this was just going to be a vacation and they didn't want to keep to his deadline. So pushing that back, another indication they just don't have the votes.
Has anything the president has done over the last several weeks seemed to be from a position of strength? It almost seems that everything he's doing is reactive here.
Well, it's a lot of defense. I agree with you entirely. I think they've been trying to take the initiative. They don't really know what else to do other than to go out and talk about this bill.
We're building a better healthcare system that works for our people, our businesses, and our government alike.
You haven't seen a new playbook because there's nothing left in the playbook. I think the White House is weary of this. Congress is weary of this. Democrats can't wait for it to be done. And at this point, they're so far in, they just want to get it done so they have something to talk about that's not health care.
So he's pushing the trip back to do what?
To make sure that he is on U.S. soil when it actually passes. Right now, keep in mind, there is no bill. Even at this late moment, there is no bill. This whole package of fixes that they've been working on does not exist. The Congressional Budget Office hasn't come back with a number on it, and members of Congress don't have anything they can go back with. So realistically, you need to give that a couple of days to marinate with House members before you vote on it. The House is going to have to vote on it. Then the Senate's going to have to pass these fixes. The House is going to have to vote on this again. The president doesn't want the image of being off in a foreign land when this is all going down.
So he's going to pick up the phone and call whom? Who does he need to work right now?
I think there's about 10 or 12 members, particularly some who voted no last time, who might be on the fence now. A lot of them are freshmen and sophomore congressmen who might be on the fence. I think if you're close, you've got to think President Obama can close the deal. He can get on the phone to a Jason Altmaier, for instance, in Pennsylvania and say, look, I know what you were before, but you got to get this one for me. This is my presidency on the line. This is the Democratic agenda on the line. That has some influence. At this point, Nancy Pelosi can say what she wants. They do not have the votes, or I think we'd be voting on it.
Rick, we've had so many deadlines on health care over the last year. What makes this deadline different than all others? Is it because we recline at the table? What's the deal here?
Well, what makes this one different is that at the end of the month, members of Congress are going to be on Easter break, and there's going to be 2 weeks when they are home. That means town hall meetings. That means random meetings in grocery stores. That means constituents are going to see their members of Congress up close. And I think it's fair to predict that any of the progress that's made in terms of vote counting this month gets lost as soon as you leave Washington. I think the end of the month is a quote-unquote real deadline. We've had lots of deadlines throughout this process, but if you go beyond the month of March, then I just can't imagine they're being able to get any more momentum behind healthcare again.
Yeah, this time they really, really mean it.
I got to say, John, you were promising your Twitter followers this morning a new hair color. I didn't realize you were going in the full Diane Sawyer direction like this.
Every day it's a little grayer. Every day it's a little grayer. But, anyway, that's it. Goodbye. We're done with you.